Every 66 seconds, another older adult in this country is diagnosed with dementia. By the time you finished watching this video, approximately 20 more families will receive that life-changing news. What many people don't realize, however, is that not every case of memory decline is simply the result of aging. In some situations, the cause may be hiding in plain sight inside a medication cabinet. I'm Dr. William. Throughout more than 15 years of caring for older adults, I've seen a concerning pattern repeat itself time and time again. A person who has always been mentally sharp begins experiencing memory problems. They start forgetting names, missing appointments, or becoming confused on routes they've driven for years. Family members often assume it's a normal part of getting older, but sometimes it isn't. In many cases, medications can play a significant role in cognitive decline. Because these drugs are prescribed by healthcare professionals and dispensed by trusted pharmacies, few people ever think to question whether they might be affecting memory or brain function. Recent research continues to highlight an important concern. Certain commonly used medications may negatively affect memory, learning, and cognitive performance, sometimes within a surprisingly short period of time. Even more concerning, many people taking these medications have no idea that their treatment could be contributing to the very symptoms they fear most. Today, we're counting down 9 medications that have been most strongly associated with memory problems and cognitive decline in older adults. We'll begin with those that are often overlooked and work our way toward the medication category I believe deserves the greatest attention. Pay particular attention to number 3. It is prescribed to millions of seniors every year for a condition that seems relatively harmless, yet evidence suggests it may have a significant impact on the areas of the brain responsible for memory. Before we begin, I'd like to hear from you. Let me know in the comments how old you are and which medications you take regularly. Understanding the experiences of this audience helps guide future topics and discussions. Let's start with number 9. Number 9, diphenhydramine, Benadryl. Many people recognize diphenhydramine by its common brand name, Benadryl. It's frequently used to relieve allergies, help with sleep, or reduce cold symptoms. Because it is available over the counter and does not require a prescription, many assume it must be relatively harmless. However, when it comes to brain health, the picture is more complicated. Diphenhydramine belongs to a group of medications known as anticholinergics. These drugs block the action of acetylcholine, a chemical messenger that plays a critical role in memory formation, learning, and maintaining mental alertness. As we age, our brains naturally produce less acetylcholine. That means older adults often have less reserve available to begin with. When a medication further blocks this important chemical, the effects on memory and thinking can become much more noticeable. One area particularly affected is the hippocampus, a region of the brain responsible for forming and storing new memories. Over the years, I've cared for many patients who used nighttime antihistamines regularly and experienced increasing mental fog without ever suspecting the medication could be contributing. Research supports these concerns. A study published in 2023 found that older adults who regularly used anticholinergic medications had a substantially higher risk of developing dementia compared with those who did not use them. The practical takeaway is simple. Carefully review the labels of sleep aids, nighttime cold medications, and allergy products. Many contain diphenhydramine under different brand names. If allergies are the issue, newer antihistamines such as loratadine, commonly known as Claritin, generally have much less impact on the brain and may be safer options for long-term use. Of course, never stop any medication without first speaking with your healthcare provider. But it's important to understand that over-the-counter does not automatically mean risk-free, particularly when it comes to memory and cognitive health. Now let's move to number 8. Number 8, proton pump inhibitors, Prilosec and Nexium. The next category may surprise many viewers because these medications are among the most commonly used treatments for heartburn and acid reflux. Proton pump inhibitors, often called PPIs, include medications such as omeprazole, Prilosec, and esomeprazole, Nexium. They work by significantly reducing acid production in the stomach, providing relief from reflux, indigestion, and chronic heartburn. For many individuals, these medications are effective and appropriate. The concern arises when they are used continuously for many years without periodic reassessment. Here's why. Stomach acid is essential for absorbing several nutrients that support healthy brain function. One of the most important is vitamin B12, which plays a critical role in maintaining healthy nerves and supporting cognitive performance. Long-term suppression of stomach acid can contribute to deficiencies in vitamin B12, magnesium, and calcium. When levels of these nutrients decline, symptoms such as fatigue, confusion, difficulty concentrating, and memory problems can begin to appear. In some cases, these symptoms may closely resemble the early stages of dementia, even though the underlying cause may be nutritional deficiency rather than neurodegenerative disease. Several large studies have examined this relationship. Researchers have observed that long-term PPI use may be associated with a higher risk of cognitive decline in older adults. Some evidence also suggests these medications may influence processes involved in Alzheimer's disease, although this area continues to be studied. The key message is not that everyone should stop taking PPIs. Rather, it's important to ensure they are being used appropriately and at the lowest effective dose. For some individuals, alternative approaches may be available. Medications such as famotidine, Pep-CD, lifestyle modifications, dietary changes, weight management, and other strategies may provide relief while reducing long-term exposure. If you've been taking a proton pump inhibitor every day for years, consider discussing whether ongoing treatment is still necessary during your next medical appointment. Now let's move to number 7. Number 7. Oxybutynin and other bladder medications. Overactive bladder can have a tremendous impact on quality of life. Frequent urgency, interrupted sleep, and the constant need to locate a restroom can make even simple daily activities stressful. That's why medications such as oxybutynin, sold under the brand name Ditropan, are commonly prescribed. Unfortunately, this medication shares an important characteristic with Benadryl. It is also a strong anticholinergic drug. Like diphenhydramine, oxybutynin blocks acetylcholine, the same chemical messenger essential for memory and cognitive function. What makes this medication particularly concerning is its ability to cross into the brain, where it can directly affect regions involved in learning and memory. Research has shown that long-term use of strong anticholinergic medications may significantly increase the risk of cognitive decline and dementia in older adults. In clinical practice, I've seen many patients describe increasing forgetfulness, difficulty concentrating, or a persistent sense of mental fog while taking these medications. Unfortunately, these symptoms are often attributed solely to aging rather than being recognized as a possible medication side effect. The encouraging news is that alternatives exist. Newer medications such as mirabegron, mirbatric, work through a different mechanism and generally do not interfere with acetylcholine in the same way. For many patients, they offer effective symptom control with a lower risk of cognitive side effects. If you're currently taking oxybutynin and have concerns about memory or mental clarity, bring it up at your next visit. Number 6 might be the most surprising one here because it is one of the most prescribed drugs on earth. Number 6. Statins. The next medication category often surprises people because these drugs are among the most commonly prescribed medications in the world. We're talking about statins, including medications such as simvastatin, marketed as Zocor, and atorvastatin, known as Lipitor. These medications have helped countless individuals lower cholesterol levels and reduce the risk of heart attacks and strokes. For many patients, statins play an important and potentially life-saving role in cardiovascular health. It's important to be clear, this is not an argument against statins. However, as with any medication, understanding both the benefits and the potential risks allows patients and healthcare providers to make better informed decisions. Many people think of cholesterol only in terms of heart disease. What is less widely understood is that cholesterol also serves important functions within the brain. In fact, the brain contains a significant amount of the body's cholesterol and relies on it to maintain healthy nerve cell structure and communication. One critical role of cholesterol is helping form myelin, the protective coating that surrounds nerve fibers and allows signals to travel efficiently throughout the nervous system. When cholesterol levels are reduced substantially, particularly over long periods of time, some researchers believe certain individuals may become more vulnerable to cognitive side effects. Research has suggested that statins capable of crossing the blood-brain barrier may have a greater impact on memory and cognitive function than those that remain largely outside the central nervous system. A study published in 2023 reported that older adults who had used statins for extended periods demonstrated a somewhat higher rate of mild cognitive impairment, particularly at higher doses. In clinical practice, some patients describe episodes of forgetfulness, difficulty recalling names, or occasional mental fog while taking certain statins. Although these effects do not occur in everyone, they are important to recognize and discuss when they arise. Fortunately, not all statins behave the same way. Medications such as pravastatin and rosuvastatin are generally believed to have less penetration into brain tissue and may be associated with fewer cognitive concerns for some individuals. If you've been taking a statin and have noticed changes in memory, concentration, or mental clarity, it's worth having a conversation with your healthcare provider. In some cases, adjusting the dosage or switching to a different statin may help while still preserving the cardiovascular benefits that make these medications so valuable. What should never happen is stopping a statin abruptly without medical guidance. For many individuals, the protection these medications provide against heart attack and stroke remains extremely important. The goal is always balance, protecting both heart health and brain health whenever possible. Before we continue, if you're finding this information helpful, consider taking a moment to support the video. Educational health information reaches more people when viewers engage with it, and that allows important conversations like this one to reach those who may need them most. And while you're here, let me know in the comments how many prescription medications you're currently taking. Medication management becomes increasingly important as we get older, and hearing your experiences helps shape future discussions. Now let's move on to number 5. Number 5, benzodiazepines. This next group of medications has been used for decades to help people manage anxiety, panic attacks, and sleep difficulties. Common examples include lorazepam, sold as Ativan, diazepam, known as Valium, and alprazolam, marketed as Xanax. When used appropriately and for short periods, these medications can provide meaningful relief. Many patients describe feeling calmer, sleeping better, and experiencing a significant reduction in anxiety symptoms shortly after starting treatment. The challenge emerges when these medications are used for extended periods of time. Benzodiazepines work by enhancing the activity of a calming brain chemical called GABA. This effect slows activity within the nervous system, reducing anxiety and promoting relaxation. While this can be beneficial in the short term, long-term suppression of brain activity may come with consequences. Several studies have raised concerns about prolonged benzodiazepine use in older adults. Research has linked long-term use to increased rates of cognitive decline, memory impairment, and a higher risk of developing dementia-related conditions. One large study followed thousands of older adults and found that individuals using benzodiazepines for several months or longer had a significantly greater likelihood of developing Alzheimer's disease compared with non-users. Longer-acting medications, such as diazepam, may be especially problematic because they remain in the body for extended periods and can accumulate over time. Patients frequently describe symptoms such as slowed thinking, difficulty concentrating, memory lapses, and a general sense of mental dullness. Some even report feeling emotionally disconnected or less engaged with daily life. One of the most challenging aspects of benzodiazepine use is that dependence can develop gradually. As the body becomes accustomed to the medication, stopping suddenly may trigger significant withdrawal symptoms. Anxiety can return more intensely than before, sleep disturbances may worsen, and some individuals can experience serious medical complications. For that reason, benzodiazepines should never be discontinued abruptly without medical supervision. If you've been taking one of these medications regularly, the safest approach is to work closely with your physician to create a gradual tapering plan when appropriate. This process often takes weeks or months and should be individualized for each patient. The good news is that alternatives exist. For anxiety, medications such as buspirone may provide relief without causing the same degree of sedation or cognitive impairment. In addition, evidence-based therapies, including cognitive behavioral therapy, have proven highly effective for both anxiety and chronic insomnia. Many patients are surprised to discover that non-medication approaches can produce lasting improvements without the cognitive risks associated with long-term sedative use. As always, treatment decisions should be made collaboratively with your healthcare provider, taking into account your individual health history, symptoms, and overall goals. Now let's move to number 4. Number 4, amitriptyline. The next medication on our list is one that many people have heard of, yet few realize it may carry significant implications for long-term brain health. Number 4 is amitriptyline, commonly sold under the brand name Elavil. Amitriptyline is an older antidepressant that continues to be prescribed for a variety of conditions. While it was originally developed to treat depression, many healthcare providers also use it for nerve pain, chronic headaches, migraine prevention, and sleep difficulties. Its versatility has made it a popular option for decades. However, that same widespread use has also led many people to overlook some of its potential cognitive effects. One of the most important things to understand about amitriptyline is that it has strong anticholinergic properties. In simple terms, it blocks the activity of acetylcholine, a chemical messenger that plays a vital role in memory formation, learning, attention, and communication between brain cells. As we age, maintaining healthy acetylcholine activity becomes increasingly important. When that system is disrupted over long periods of time, cognitive performance can gradually begin to suffer. Research has consistently linked prolonged exposure to strong anticholinergic medications with an increased risk of memory impairment and dementia in older adults. One major study published in 2015 followed thousands of adults over the age of 65 and found that individuals with the highest cumulative exposure to anticholinergic medications had a substantially greater risk of developing dementia over time. What makes this particularly concerning is how gradually the changes can occur. Many people do not notice a dramatic decline overnight. Instead, they begin forgetting words more often. Concentration becomes more difficult. Names become harder to recall. Mental sharpness slowly fades, often over the course of years. Because these changes happen gradually, they are frequently dismissed as a normal part of aging rather than recognized as a possible medication-related effect. Even relatively low doses taken consistently over long periods may contribute to this burden. If you currently take amitriptyline, it does not necessarily mean the medication is inappropriate or harmful in your specific case. However, it does mean the benefits and risks should be reviewed periodically with your healthcare provider. Depending on the reason it was prescribed, alternative treatments may be available. For nerve pain, medications such as duloxetine or gabapentin may offer relief with less anticholinergic activity. For sleep difficulties, options such as melatonin or other carefully selected therapies may be considered. And for depression, newer antidepressants often provide effective treatment with fewer concerns regarding cognitive function. The key message is awareness. Understanding how medications affect the brain allows patients and physicians to make informed decisions that support both symptom relief and long-term cognitive health. Now let's move to number 3, the medication I specifically encouraged you to watch for. Number 3, paroxetine, Paxil. This medication is prescribed to millions of people worldwide and is often viewed as a modern treatment option for depression and anxiety. Paroxetine, sold under the brand name Paxil, belongs to a group of medications known as selective serotonin reuptake inhibitors, or SSRIs. SSRIs are generally considered safer and better tolerated than many older antidepressants. In fact, several medications in this class are commonly recommended for older adults because of their favorable safety profiles. However, paroxetine is different. Among the SSRI family, paroxetine stands out because it possesses significant anticholinergic activity. That means it affects the same acetylcholine system we've discussed throughout this countdown, the system that plays a critical role in memory, learning, and mental clarity. This distinction is extremely important because many patients and even some caregivers assume all SSRIs carry the same cognitive profile. In reality, paroxetine behaves differently from medications such as sertraline or escitalopram. Several studies have examined the cognitive effects of paroxetine in older adults. Researchers have observed measurable declines in areas such as short-term memory, attention, and word recall among some individuals using the medication over time. In one large review, older adults taking paroxetine demonstrated a higher likelihood of showing early signs of cognitive impairment compared with those taking alternative antidepressants. The irony is difficult to ignore. A medication prescribed to support emotional well-being and mental health may, in some individuals, contribute to challenges involving memory and cognitive performance. That does not mean everyone taking paroxetine will experience these effects. Many people benefit from the medication and tolerate it well. However, older adults deserve to understand the differences between available treatment options. This concern is one of the reasons why the American Geriatric Society includes paroxetine on the Beers criteria, a widely respected list of medications that may present increased risks for older adults. If you're currently taking paroxetine, do not stop it abruptly. Sudden discontinuation can cause withdrawal symptoms and other complications. Instead, speak with your physician about whether the medication remains the best choice for your situation. Depending on your medical history and treatment goals, alternatives such as sertraline or escitalopram may provide similar benefits while posing fewer concerns regarding cognitive function. In addition, maintaining good nutritional health, including adequate intake of important nutrients such as vitamin B12 and vitamin B6, may support both mood and overall neurological function as part of a comprehensive treatment plan. Now let's move to number 2. This next category is often prescribed so quietly that many people taking these medications may not even realize what type of drug they have been given. Number 2. Antipsychotic medications. The next category of medications is one that deserves careful attention, particularly when it comes to older adults. Number 2 on our list is antipsychotic medication. This category includes drugs such as quetiapine, commonly known as Seroquel, risperidone, marketed as Risperdal, and olanzapine, sold under the brand name Zyprexa. These medications were originally developed to treat serious psychiatric conditions, including schizophrenia, bipolar disorder, and certain severe behavioral disorders. In those situations, they can be highly effective and, in many cases, medically necessary. However, over the years, their use has expanded far beyond their original purpose. Today, antipsychotic medications are sometimes prescribed to older adults for symptoms such as agitation, restlessness, sleep disturbances, or behavioral changes associated with dementia. While there are circumstances where these medications may be appropriate, it is important to recognize that they carry significant risks, especially in older populations. Research has consistently shown that antipsychotic medications can contribute to worsening cognitive function in vulnerable individuals. Studies have also linked their use to increased risks of stroke, falls, hospitalization, excessive sedation, and, in some cases, even increased mortality among older adults with dementia. One reason for these effects is the way these medications influence dopamine, a critical brain chemical involved in motivation, focus, attention, decision-making, and memory. When dopamine activity is significantly reduced, the brain may become slower and less responsive. Family members sometimes notice that a loved one seems withdrawn, emotionally flat, less engaged, or unusually sedated after starting these medications. What makes this especially difficult is that these changes are often mistaken for progression of dementia itself. In reality, the medication may be contributing to some of the decline being observed. If you or someone you care for is currently taking an antipsychotic medication, one important question to discuss with the prescribing physician is simple. Why was this medication started, and does it remain necessary today? In many situations, behavioral symptoms can be improved through non-medication approaches. Consistent routines, improved sleep habits, proper pain management, reduced environmental stress, and supportive caregiving strategies can sometimes produce meaningful improvements without exposing the brain to additional medication-related risks. When antipsychotic treatment is truly necessary, the safest approach is generally to use the lowest effective dose for the shortest appropriate period while monitoring closely for side effects. Open communication between patients, caregivers, and healthcare providers is essential. Now we arrive at the final position on our countdown, and surprisingly, number 1 is not a single medication. Number 1, anticholinergic polypharmacy. In my opinion, this is one of the most important and least discussed causes of medication-related memory decline in older adults. The term may sound complicated, but the concept is straightforward. Polypharmacy simply means taking multiple medications at the same time. Anticholinergic burden refers to the combined effect of several medications that all block acetylcholine, the critical brain chemical responsible for memory, learning, attention, and communication between neurons. Throughout this countdown, we've discussed several medications that affect this system. The real danger often occurs when multiple medications with anticholinergic effects are taken together. Consider a common example. An older adult takes diphenhydramine at night to help with sleep. They take oxybutynin for bladder symptoms. They also take amitriptyline for chronic pain. Individually, each medication may seem relatively manageable, but when combined, their effects accumulate. Instead of one medication interfering with acetylcholine, several medications are now working against the same memory system simultaneously. This cumulative burden can place tremendous stress on the aging brain. Large studies have shown that individuals with the highest anticholinergic burden face significantly increased risks of cognitive decline and dementia compared with those taking fewer or lower risk medications. Perhaps most concerning is that many people have no idea they are taking anticholinergic medications at all. No one explains the connection. No one adds up the total burden. And as memory problems gradually develop, the changes are often blamed entirely on aging. From a neurological standpoint, when acetylcholine is repeatedly blocked from multiple directions, communication between brain cells becomes less efficient. Over time, memory formation, attention, processing speed, and overall cognitive performance may begin to decline. Fortunately, there is also good news. Unlike many causes of dementia, medication-related cognitive impairment may be at least partially reversible when identified early. I've seen patients regain mental clarity, improved concentration, and better memory after carefully reducing unnecessary medications under professional supervision. The brain possesses a remarkable ability to recover when harmful influences are removed and proper support is provided. That is why medication review is so important. If you take multiple medications, I strongly encourage you to schedule a comprehensive review with your physician or pharmacist. Bring every prescription medication, bring every over-the-counter product, bring every vitamin, herbal supplement, and sleep aid. Review them one by one. Ask whether each medication remains necessary. Ask whether safer alternatives exist. Ask whether any combination may be increasing your anticholinergic burden. These conversations can be extraordinarily valuable and, in some cases, life-changing. The goal is never to stop important medications unnecessarily. The goal is to ensure that every medication is truly helping more than it is harming. For many older adults, this simple process may represent one of the most effective steps available for protecting long-term brain health. And that is precisely why anticholinergic polypharmacy earns the #1 position on this list. Before we finish, I'd like to hear from you. Have any of the medications we discussed today surprised you? Are any of them currently in your medicine cabinet? Have you noticed increased forgetfulness, mental fog, or changes in concentration after starting a new medication? Share your experience in the comments below. Your story may help another person recognize a problem they had never considered. Most importantly, if today's discussion has encouraged you to take a closer look at your medications, consider scheduling a medication review with your healthcare provider this week. It may be one of the most valuable conversations you have regarding your long-term cognitive health. And before you leave, remember that the body often provides warning signs long before serious symptoms develop. Many people focus on medications, but there are other clues worth paying attention to as well. One surprising place those clues can appear is in your fingernails. Changes in the nails can sometimes reflect issues involving circulation, nutrition, kidney function, blood health, and even aspects of nervous system function. Most people never learn what to look for. In our next discussion, I'll walk you through 4 important nail changes that may deserve medical attention and explain what they could potentially reveal about your overall health. I'm Dr. William. Thank you for watching. Stay informed, stay proactive about your health, and I look forward to seeing you in the next video.